have been raised not only here in Kenya but also abroad, with even some countries suspending the use of the Oxford AstraZeneca vaccine, which we are currently using in the country. Of course, the World Health Organization and of course the company itself has talked about the efficacy of the jab, and talking about they are just mild side effects, just like you have side effects when we have other medication. But that has not stopped some countries from giving a wide berth to that vaccine. But today we are talking about that, the distribution, and of course all the surrounding things that come with that vaccine. And we have Dr. Nazila Ganatra, who is the head of Department and National Strategic Public Health Programs in the Ministry of Health. And thank you indeed for making time. And
thank you very much. Before
then, we were talking about the third wave that we have in the country. But of course, if we observe the protocols that we have been talking about since COVID landed in the country slightly over a year ago, then we will be fine. And talking of the third wave, the technology that you are using, kindly explain a little bit. You touched on it when you talked about Chanjo
KE.
Chanjo KE.
Yes.
How does it work?
So it's a system which has been designed specifically for the vaccine rollout, but eventually we'll roll it out to all the other routine immunization programs as well. So this vaccine program, this platform, the software, is very important for us so that we could be able to track exactly who's getting the vaccine and the batch number that they're getting it from, and any adverse drug events following immunization can be reported on that system. You know, we need the data so that we could be able to make informed decisions, even as the National Task Force. So what happens is that initially we had planned to do pre-registration of persons to come to the facility, pre-register, and then they called for the jab. But very soon we'll be also having self-registration portal. They're working on it, the IT team, and in fact we'd like to commend them because they've come up with this system in a very tight schedule and timeline.
Yeah.
So so what happens is that once a person goes to a facility, a healthcare facility, they're able to register themselves over there. The usual, the name, date, identification, the sex, gender, and then race, religion, all the normal, the information that is required. After that, we issue when the vaccination, we check the temperature and everything, we do the triaging, after which we go for vaccination. The batch number of the commodity that we're going to use, and in this case it's going to be the AstraZeneca vaccine, will be recorded into the system, and you'll then get your vaccine jab. Immediately you get that, you'll get a message on your cell phone that you have received the vaccine, your first dose, on this date, and this is the batch number. So this is very important for two reasons. One is the security reasons, to track each and every vial of the vaccine so that we are accountable of this vaccine, so that we later don't see some pilferage or any other story that they got lost or something. So there is that tracking, track and trace, right? And then the second one is another important thing. The adverse events following immunization are a very important aspect in this case, considering that this is a vaccine which was given emergency use authorization by the WHO as well as the Pharmacy and Poisons Board here in Kenya. We know that it's a fairly new vaccine, although the clinical and safety data has been carried out and therefore issued with this emergency use authorization. It's very important for any person who experiences an adverse event or adverse event following immunization to actually report on this system so that we could be having our own data to be able to make decisions if not even within locally in our country, we could also be able to give this data to WHO, because this is a global pandemic. We're all sharing information. Maybe our demographic population may not be affected or will not have ADRs which other people are sort of reporting. So this is a very important aspect, that you are aware. If you have any AEFI, that is the adverse event following immunization, you are able to report that AEI. You can also be able to specify which batch number you got. So in case there's an issue with the batch, then you could easily be able to either halt or recall, or, you know, there are very many decisions which can be made with that kind of data. Yes.
And talking of data, we've seen, and especially when we were doing contact tracing, people actually giving out wrong information in regards to their contact. How are you ensuring that you seal this? Because the other one actually had a lot of issues, somebody giving out another number, somebody giving out somebody else's number. So we had an issue with contact tracing. How are we making sure that this one is airtight? Because when we have talking about vaccines that are being offered for free, it could be a channel for people to start salivating over the money that could come out of the COVID-19 vaccine.
Yes. So, you know, this is not... I think the reason why people were giving the wrong numbers at that time is because of the fear of being quarantined or isolated. In this case, there is no fear. We're not going to quarantine you or isolate. We just want to track you.
And Kenyans know that.
Yes. Yes. So once you give your contact, we can be able to follow you. For instance, if after the vaccination and we have monitored you for 15 to 30 minutes, there is no adverse event which has taken place at the facility, but then you go home and you start experiencing an adverse event following immunization, and you can call us back, you know, and or come back to the facility and report that. Then the people on the ground, especially the Pharmacy and Poisons Board, as well as the National Vaccine Immunization Program, those investigators will take your contact and closely follow you to see, have your effects reduced? Is there something that you know, you need help? So this type of contact tracing is not to pick you up and probably isolate you.
Yes.
It's actually to assist you so that you're more comfortable and you get better.
In short, you're saying that you've also put in measures just in case somebody has adverse effects after that person has gone home.
Yes. So if there's an adverse event, you could either come back to the facility to report, but there are also online reporting systems, such as...
Still on this... Chanjo KE.
Yeah, so there's the one in Chanjo KE, but there's also the Pharmacy and Poisons Board. So this data from both the Chanjo KE and the Pharmacy and Poisons Board will be consolidated, and an expert committee has already been formed, which will be going through this data, especially where the adverse events following immunization take place, so that they could be able to make informed decisions, which would guide even the larger task force on the way forward.
Of course, when we are talking about the vaccine, we have to also factor in the cost. And looking at some of the costs that we're seeing on the internet, of course, we have to factor in the transport and the other logistical issues. What can Kenyans expect, perhaps how much, to get a vaccine? All
right, so currently, the government has procured the vaccines through the Gavi COVAX facility. The price is constant along this particular COVAX facility, and but as a government, we are not going to charge for these vaccines. They'll be issued for free. Yes.
And we've seen a lot of EU nations skip the COVID AstraZeneca, and looking at the temperature, looking at the environment, the climate, there is quite different from Africa. Could that be perhaps the reason why we are experiencing countries opting to give AstraZeneca vaccine a wide berth? Because perhaps it works different in a certain setting as opposed to others. Like in Africa, of course, we are in the sub-Saharan Africa, and looking at Europe, and the Scandinavian countries, of which have all actually suspended the use of that vaccine, they have different temperatures, different climates, and of course, different everything is different.
Yeah, so we have, as I had said earlier, that we are using the AstraZeneca because of the emergency use authorization, which was issued by the WHO as well as the Pharmacy and Poisons Board. Another reason for actually going for the AstraZeneca was, okay, of course that's the main reason, because if it's not granted the emergency use authorization, then we could not be able to utilize it here. But further, we were also looking at the cost of this vaccine. It is pocket friendly for us, and the storage conditions. As we had said, we're using the existing infrastructure, and therefore these vaccines can actually utilize that infrastructure. We don't have to have investments in infrastructure at the moment. But also, not only that, we also had clinical trials of the AstraZeneca vaccine here in Kenya. So, and there were no major issues which were raised at that time. So therefore, this is what we have opted to use at the moment.
And looking at the cost, still on the cost, we have other costs other than the vial itself. We also have the syringes. We also have the what do you call them? Of course, we have other costs other than the vial itself.
Yes.
Are we the ones still shouldering that cost? And how can we bring it down so that when we start receiving the COVID vaccines in private facilities, of course, the cost could be down so that each and every Kenyan can be able to access it?
So at the moment, since the vaccines are free and public health facilities, we don't really require a lot of okay, like the vaccines are coming with their own syringes. Yes. So that cost has been sorted. But however, when we look at the private sector, when it brings in the vaccines, we still have to, I think discussions are still ongoing and guidelines which will be issued on that regard. Yeah.
And I believe the last time I had a vaccine was when I was a baby. So actually I can't exactly remember what are some of the normal side effects of a vaccine other than this one. What are some of the side effects? So
you'll get the pain at the injection site.
That's normal.
Yeah, that's normal. Sometimes you can get fever, right? Some chills, body pain. But this is actually just your immune response. You see, your body is now gearing up to fight the vaccine that you have introduced into your body. So it's your body producing antibodies to fight the infection, if it recognizes. It can happen, either it's viral or bacterial infection. It's sort of producing antibodies to fight. So it's your immune response, prepping up. So you shouldn't be worried.
And are there other factors that play out when you talk about a vaccine? Looking at America, they are using the Pfizer and BioNTech. Looking at Russia, and some of the countries which were in the USSR, they are using the Sputnik. Looking at Europe, a lot of countries were using AstraZeneca before they switched, or they decided first of all to put it aside. Does it depend on perhaps on climate, on perhaps on regions or something like that, or it's purely on countries basis, their preference?
I think it's purely on country basis. I don't think the weather or the demographics actually play a role in this.
Okay, kindly hold that thought. I'm informed that the government spokesman is currently holding a press briefing at his office at the Teleposta Towers. Let's first of all listen in.
Collaboration and cooperation is that you've always been able to carry out our messages or information to the audience that is Wanjiko. Each and every time we give it out to you. And therefore, from me as the government spokesperson, I just want to say thank you for that collaboration. And perhaps the least we can do is to try and deepen it and even extend it even further. That we must consistently be able to work together for the betterment of our society. Because a society that is not well informed is a society that has no future, because information is power. And for you to move forward to the next stage of whatever development, then you need that information. And therefore, as the office of the government spokesperson and the media, we must be able to consistently work together to be able to meet our objectives as the government, but also as members of the media. Now today, I want to look at a couple of issues that are topical. And the first issue that I would wish that we look at is national examinations. You're all aware that national examinations are just about to start. Maybe practicals have already started, but the other papers are bound to start in the coming days. But you're also aware that we are talking about an examination when we are still in the middle of a pandemic. We'd recall that sometime last year around March, learning was suspended as part of the containment measures against COVID. This was later followed by 7 months gradual reopening of schools for learners who are in the examination classes. We're talking about class 8, Form 4, and also grade 3. That was sometime in October last year, after 7 months of being at home. Subsequently, sometime this year, around about 4th January, there was full reopening of schools, and learning has been going on since then till today. So despite of the disruption that coronavirus did bring or meet into our society, we as a country have been very resilient, and today we are able to talk about being ready to conduct examinations when it looked like it's going to be a lost year for most of our learners. So as a country, I think we need to be very proud of what we've been able to achieve, particularly considering that there are those who predicted nothing but doom and gloom. So as the government, we are ready to be able to administer exams to our learners and our candidates who are in class 8 and Form 4. And effective measures have been put in place by the government to ensure that this year's examinations are able to go out and to be rolled out in an efficient and a seamless manner. And therefore, it is all systems go. Examinations shall be conducted as follows. You may already be having the dates, but just for the sake of those who may not be having the dates, for KCSE, that is Kenya Certificate Secondary Education, dates are from 8th of March, which is already passed, and that is because practical exams are already ongoing, to 21st of April. And the candidate population for KCSE, we are talking about 752,981. And the centers that will be used to administer examination for this cohort are 28,437 centers across the country. Now for KCPE, that is for primary, examinations will be from 22nd to 24th March, a couple of days ahead. And we're talking about candidate population of 1.191725. That is 1,191,725. The number of exam centers across the country will be 10,437. There will be a concern really regarding areas like Merti, Kapedo, and even other locations that have been affected by rising lake waters or where facilities have been submerged. Now, I'm here to inform you that examinations will be conducted across the country, including Kapedo and Merti that have had issues to do with insecurity. Kapedo is perhaps one of the safest places now in the country, and these centers that I've mentioned are established even in Kapedo, including Merti. So there is no student that will be denied the opportunity to do examination because of insecurity. We have got sufficient measures in place to ensure that exams are conducted in a safe and secure environment. Even students that were or that whose schools were affected by the rising lake waters in areas of Baringo, you're aware about many facilities that were submerged. Such students were transferred to other facilities and they have been registered there, and therefore they'll be able also to sit for examinations just like any other students. And therefore, there is no cause for alarm. Everything has been put in place, and the government has thought about this back to back. So there is nobody, no candidate that will be denied opportunity to sit for exam, either because of school fees or because of circumstances where their schools were. So that has been taken care of by the government. This is a multi-agency activity, meaning that we're not just talking about Kenya National Examination Council on its own or Ministry of Education on its own. We are talking about a multi-agency where there are several players, some of them agencies of the government that have come in to ensure that these examinations are carried out in a successful manner. Now, some of these agencies, you may wish to know, of course, Ministry of Interior must be there for reasons that you understand, because of security and integrity of these examinations. So local administration at the forefront of this to ensure that the integrity of the examinations are upheld or is upheld. Of course, the police equally the same for reasons, again, that we understand. And there has been also an establishment of a command center for purposes of communication to allow quick response. So in the event that something happens somewhere in those far-flung areas, there will be communication to the command center, and a response will be initiated quickly to be able to deal with that situation. So everything has been put in place to ensure that there is no disruption and that exam activities will go on uninterrupted. Even as we conduct these exams, like I said at the very beginning, we are all aware that COVID is pretty much in our midst. We're talking about a third wave, having come from a second wave, and therefore, even as we conduct these exams, they will be conducted under an environment of adherence to COVID protocols. So even as you move around some of these centers, if you'll be allowed, depending if you are able to seek permission to be able to go there, they will be conducted under strict observance of COVID-19 protocols or measures. So there'll be sufficient spacing. All candidates will be having face masks, and there'll be sanitizers or hand washing stations as they get into the examination rooms. We must be concerned about the health of our learners. So the government has put all measures in place to ensure that one is happening. Finally, in as far as this is concerned, I want also to inform you that the government has been able to mobilize all resources that pertains to efficient management and administration of examinations. So there is nothing that the government has left to chance. So everything is being put in order. But I also want to take this opportunity to thank the teachers. A lot of times we do not necessarily appreciate the work they do, but remember, we are talking about examination. Want that have been able to prepare these learners to get to a point where now they can be able to sit for exams. And they have done this sometimes under very, very difficult circumstances and conditions. And therefore I want to take this opportunity to thank the teachers for preparing these learners to be ready to be examined. But number two, I also want to thank the parents as well as guardians. You remember initially when schools were reopened last year for class 8 and Form 4, there was instruction that nobody will be allowed to visit schools as part of the containment measures. And the parents and guardians abided by that. And that has been the case until today. And therefore, they have been very supportive and understanding. I also want to take this opportunity to thank them for that. Of course, plus the other stakeholders who have been very, very instrumental in ensuring that the learning has gone on uninterrupted. Until now, we are talking about administering exams. So finally, I just want to take this opportunity to wish the candidates the best of luck. We are aware as a government that they've been out for 7 months, but exams are normally set for the average student. And because most of our children are beyond average, got no doubt in our mind that this will be an easy exam for them. So they should not be worried whatsoever. Now, the next thing I want to talk about is something that is very close to the hearts of many. And I want to talk about the crashes on our roads. And this is about the many accidents, let me not call them accidents, let me just call them crashes, that we experience every single day on our roads. At least each and everyone in this room has somebody that they know that has been involved in a crash. If not a close relative, maybe then a close friend, a friend to a friend that you know of. And most of these crashes, believe it or not, are crashes that are preventable. Most of them. But nonetheless, they cost huge amounts of money. Sometimes loss of life or maiming someone for life. So then when an accident happens, other than looking at the person who has been involved in the accident as the victim, he may be the sole breadwinner of some of these families. Sometimes they stay in a hospital for a very long time, and therefore forcing the families to even sell their property or deplete their savings, and therefore leaving such families destitute because of an act of a crash that could have been very easily avoided. You know, the government has done what it is supposed to do, to set regulatory framework, to formulate laws, and even codes. But codes alone will not help one to obey traffic rules. There must be a mindset that predisposes somebody to obey traffic regulations. Even here in this hall today, I know that some of you have been able to jump traffic lights. And you do it knowingly. You look left, right, half the back, and half the only one on a Sunday afternoon, and there you go. The most strange thing about it all is this. When we go to other countries, it could be going perhaps to Europe, for those who have been able to travel there. When you go to perhaps, even a country within this region called Rwanda, when you go there and you're driving, we obey those traffic rules. Why is it so hard for us to obey them here? Now, because of that mindset, that is why this country, despite of having very few vehicles, the vehicles we have on our roads are not many. We may think that they are many, but they are not really. So when you compare the number of vehicles and the fatal crashes that we experience in this country, it's too much. And it shouldn't be. And the whole purpose, or the whole idea behind that is because of mindset. Mindset that you want to be the one on the road alone. Mindset that this vehicle can move. Let's try to find out how fast it can go. Mindset that you don't care whether this matatu driver is overspeeding and you're the one sitting in that matatu, and sometimes even cheer the matatu driver on. Until an accident happens, then we turn back and say...
Indeed, that is the government spokesperson, Colonel retired Cyrus Oguna, giving the state of address in regards to the upcoming Kenya Certificate of Primary and Kenya Certificate of Secondary Education examinations. 7 months our learners were out of class because of the COVID-19 pandemic. But some of the things that he has touched on is that all the preparations for the exams have been completed and all is set and secure. And something very important he has talked about is that you do remember that they were students who were displaced because of either security issues or even because of floods and rising water levels. But he has said that all students were transferred and they will be sitting for their examination with no problems at all. And something else that we have been experiencing, and especially in the Rift, in the North Rift, is because of insecurity has been quite something that the government has even had to issue even more stringent curfew, 6 to 6 in the morning, And of course, security there has been a big challenge, but he has said that all is set and done for that. Just in case you're joining us, this is News Check, and today we are looking at the COVID-19 vaccine that landed in the country 13 days ago. Of course, several concerns raised by countries, and also Kenyans have also raised some of the concerns, and we are trying to address them and seeing what could be the next way forward. And I'm joined by Daktari here from the National Strategic Public Health Programs, where she is the head, and that is Dr. Nazila Ganatra. And before the break, we were talking about vaccinations and regions. We've seen North America, they kind of prefer, in America they're preferring the Pfizer. In Europe they prefer the AstraZeneca before the suspension by some of the countries. We've seen in the Scandinavian countries, they kind of torn between the Russian one, Sputnik, and AstraZeneca, but mostly in Africa, I've seen it's AstraZeneca that we are currently using. Any reason for that?
Well, AstraZeneca, as I had mentioned earlier, has actually undergone the emergency use authorization listing by the WHO. And it's also available under the COVAX facility, the Gavi COVAX facility, which ensures that all countries get the vaccine in an equitable manner at a cost which is standardized across all countries who are under that particular facility.
And talking about equity of vaccines, I was watching one of the international media stations quite early in the morning, and talking about 1 in every 5 Americans have been able to get a COVID vaccine jab. But looking at countries like Kenya and others, we're quite lagging behind. Of course, there are several factors that play out in such a case. But what do you think Africa should do to ensure that we are not always holding the short end of the stick when it comes to things like vaccination and development of vaccines? And of course, we are learned. We can be able, as you said, Oxford, the AstraZeneca, Kenyans did participate even in the trials and perhaps some of the research that went into making of that vaccine. But looking at the big disparity and talking about equity, I don't think that is equity.
So, of course, we as Africa and Kenya, we are always sort of like getting these vaccines. Like at this time, the Western have actually invested in R&D. So I believe that moving forward now, this will be some of the lessons learned. We'll be able to now try and focus. We have learned people around. We could start actually focusing and giving priority to our research as well, so that we could also be able to become independent and be able to develop our own vaccines, which could be used even worldwide. So, I mean, why not?
Okay. And something that has stood out in Colonel Oguna's speech is the matter of security. And of course, a couple of months we saw even a GSU commandant was murdered there, because that place has rampant insecurity cases that we have seen over the last couple of months. How do we ensure that in the distribution of the COVID-19 vaccines, that all security protocols have been observed? Have you put any security measures? Because of course we need these vaccines even to the deepest and most insecure parts of the country.
Yes, as a task force, we had discussed this. There was also an aspect of security, and the relevant ministries and authorities have been engaged, and they have been providing the security. And also, that apart, we have also been monitoring the batch numbers of the vaccine, right from the central stores to the regional stores, and ensuring that each facility gets a specific number of vaccines with the batch number attached to it. So we could be able to monitor the entire pipeline. Yeah.
And how do you ensure that only those that have been earmarked to receive the vaccine, you're talking about the healthcare workers, the security, the teachers, are the ones that get the vaccine? We don't hear about a case that we've seen politicians that might decide to circumvent the whole event so that they may benefit for perhaps themselves and their families. How do we ensure that the process is airtight, that only those that are mandated and earmarked to receive the jab receive the first jab, as we are doing right now?
So, of course, first is the communication aspect. We are communicating with the various stakeholders or participants in the first phase. Like right now, our communication is just channeled to healthcare workers. Of course, when they come in, they have professional numbers. You know, when you register, like I'm a pharmacist by profession, so I have my registration number from the Pharmacy and Poisons Board. So when I walk in over there, I have to provide that number. Yes, so I'm sure the teachers will also have similar sort of categories, as well as the military people, like the personnel. But however, we're also using the identification card as well as passport when we're taking that information in the Chanjo system. Yeah.
And looking at all the vaccines that we have, we can't really say that they are 100% effective. But in the coming months, in the coming years, we will be having an airtight vaccine that will be just like what we've had over the years for BCGs and stuff. We'll be having a vaccine that really works. What happens if I get an AstraZeneca vaccine today, and perhaps in the next couple of months or perhaps years, we find another vaccine? Or perhaps I move to the United States, whether they're using Pfizer, or perhaps in Russia where they're using Sputnik. Can I have a second dose of a different vaccine?
All right, that's a very important question. So if, for example, we're taking the AstraZeneca vaccine right now, and you get the first dose, and then let's say after the 8 to 12 weeks, maybe you're now in the US and you can only access the Pfizer vaccine. So you will just take the Pfizer vaccine. However, you will not take the second dose, but you'll start the dosage again. This is because the technologies which have been utilized to make or manufacture these vaccines are actually different. So therefore, to be able to get the maximum benefit of the vaccine, you'll have to start with the first dose of the Pfizer, and then you wait for the second dose.
We shouldn't expect any perhaps reactions to the body, because at least the body recognizes that there is something that there is the vaccine, the COVID, the AstraZeneca. So there won't be a problem of using another one. Of course, they're using different technologies to fight the same thing.
Yes, there shouldn't be a problem. Although, of course, studies are still being done on that issue. You know, the vaccines are fairly new, so the information is also just trickling in, and we're trying to consolidate. However, it's of course recommended that you just stick to the current regimen. We're also not really sure if it is going to be an annual vaccination thing or what. So at the moment, we'll just take the vaccine and then await further guidance from the WHO and other regulatory authorities.
Take me through the process, assuming that I'm a teacher or I'm a healthcare worker, and the first thing, of course, I'll get the jab. What is the documentation, paperwork, certificates? Do you have anything like this one?
Yes. So as I was mentioned earlier, we have the Chanjo system, which has been developed for this vaccination program, the COVID-19 vaccination, but eventually it will be rolled out to other vaccines, routine vaccines as well. So there is not much paperwork. You just have to register yourself, of course, with your credentials, name, your location in case somebody needs to go to you. In case of an adverse event following immunization, one needs a follow-up, so those details will be there. After the first dose, you'll get a message on your phone, because you'll provide your phone number about the vaccine that you've taken, on what date, what batch number, and your subsequent dose, the date. And a reminder will then be sent in due course, so that after the 8 to 12 weeks, you'll get a reminder reminding you to please report to the facility so that you could be able to get the vaccine. Once you have gotten your second vaccine now, of course, the process will be the same. You'll not need to register again. You'll just go, maybe give your identification card, and you'll already be in the system. So then you will get your second dose. Immediately after you get your second dose, a certificate will automatically be generated into the system. It is a very specific certificate, so that it, to avoid any, what do you call it?
Actually, the paperwork itself.
Yes.
To ensure that...
to ensure that it's a genuine certificate, right? So it will be properly earmarked right, to ensure that you get it. Once you get that certificate, you could be able to print it and utilize it. I'm sure once the borders fully open up, we'll be all required to produce a COVID vaccination certificate. It might be a mandatory requirement. We don't know at the moment.
Yes.
But in the event that it is, then we have this certificate which you can be able to utilize. Yes.
And of course, when we talk about vaccines, a lot is talked about looking at conditions. Sometimes you hear that if you have certain conditions, you're not supposed to take a certain vaccine. Looking at the COVID one, a lot of Kenyans, let's be honest, do not know that they already have an existing condition. And from what we see is that we're just seeing somebody just gets a jab, we wake up, you go. There are no tests, perhaps to ascertain whether you should get the COVID-19 vaccine or could be a reaction or something. Do you think perhaps there should be something like that, a platform perhaps for anybody who feels that their body could be having an issue to first of all get some tests before getting the vaccine, because we do not know what will happen after receiving the jab. The COVID vaccines have been here for what, like 1, 2, 3 months?
Yes. So in terms of having the COVID vaccine and reacting to it or being allergic to it, of course we have to see the risk analysis. In case you feel that there might be an issue with yourself, maybe with the contents of the vaccine, then it's always good to seek medical attention and guidance from your medical doctor.
Mm-hmm.
Yeah.
You received the AstraZeneca and of course the Pfizer. There are two doses. How am I sure that after I receive the first dose, I'm going to receive the second dose? Will not have some shortage or something like that?
All right, that's a very important question. So, as I'd mentioned earlier, we have got various subcommittees under the larger National Task Force, COVID Deployment Vaccine Task Force. Mm-hmm. And the specific committees that are actually looking at those specific areas. For example, now we have a committee for procurement and logistics. Mm-hmm. Already, they have requested for another batch of vaccines. Mm-hmm. And the logistics have been planned in such a way that we will not have a miss out of any of those commodities for the second dose.
So they are coming like what? We can say like a pair, so that we make sure that...
Like when we are doing the forecasting and quantification, we are working with the population, the targeted population, right? So already for the first phase we have received. So now we are procuring for the second phase. So we already have the vaccines for the first targeted phase population. Yes.
Since COVID-19 was reported in the country, Nairobi has always been leading in the number of cases reported every day. We're talking about a quarter, where some countries, of course, have had the jab, and like America, they're doing very well. 1 in every 5 Americans at least has had a jab. How do we ensure that we redistribute it in a way that will be actually represent the national picture that we have? Or do we have the 47 counties receiving exactly the same number of COVID-19 vaccines?
So the counties are actually receiving according to the at the moment, they're receiving according to the target population that we're targeting in the first phase. So that is what we're using. And as I'd mentioned earlier, since the counties are also having similar task forces replicated, so they are also doing their own micro-planning and coming up with the logistics, which they will then share with the National Task Force, COVID-19 Task Force, such that they can be able to receive their commodities, yes, in good time and in the right quantities.
Exactly, where Nairobi, Mombasa, Kiambu have been leading, of course, there's a way that you are going to be able to distribute them to make sure that in the counties that are experiencing very few number of infections or low infection rates, get, for lack of a better word, a quota system that will be used in the vaccinations, right?
No, we are actually targeting the healthcare workers in those settings, the essential, or the second phase. Yes, the second phase we also have to check the population. So it's that specific population, then we have to give as per the request per county.
Yes, of course, we do not know all the COVID-19 vaccine. I've heard over 100 in trial, in the last phases of trials, but we are hoping that, of course, they will work and not have side effects that, like we have seen being reported. But of course, we need to pick up the pace because of time. But what would you say, or what do you tell Kenyans in regards to the COVID vaccine and the COVID protocols now that we are in the third wave?
All right. So what I'd like to emphasize is that we have to adhere to the COVID protocols, the masking, the sanitizing, hand washing, and the maintaining of the social distance. That is very important because we are still in the pandemic. We also encourage the eligible persons under the currently the first phase to actually go take this opportunity and take the vaccines. It will protect them, protect their loved ones, their family, and in case of an infection, the severity will not be as such. So, so we'll be happy and safe and hopefully return back to normal.
Indeed. Of course, your department is tasked with a very noble job, noble duty, because the COVID-19 vaccine, everybody is really watching out so that Kenya can be one of the countries that has made tremendous steps in terms of the medication and the vaccination. Your final words, can you assure Kenyans that the whole process will be as transparent as possible, and each and every group that is supposed to get the COVID vaccine will get that? Of course, we've seen some issues that have really brought Kenya down when it comes to the COVID fight. We had KEMSA, we had also other issues that have come up in regards to the COVID-19 fight.
Yes, so we would like to encourage everyone to take the vaccine and to know that this process is, we're trying to make it as seamless as possible and as transparent as possible. So for any questions or any information that is required, we are always there to give all the information. And information for everyone. We also encourage the healthcare workers and the other essential workers to come in numbers and be able to take the vaccines. And also, in case of any adverse event following immunization, kindly report this incident so that we could also have our own database, which we could also share globally for global information and knowledge, so that we can all make informed decisions with that.
Still on the same, just as we wind up, the World Health Organization did start a portal after the first case was reported, giving us an update on perhaps the number of cases, giving us an update on how things are, the number of deaths, of course giving us all the protocols that we need to observe. Do we have a protocol, a portal here in Kenya that we can be able to track? You talked about Chanjo KE.
Yes.
Can you get all the information, perhaps the number of people who have been vaccinated, perhaps the number of, basically the number of the vaccines that have in the country and how they have been distributed? Do we have such kind of a portal?
Yeah, this particular system will actually give all that information. Of course, as I had mentioned earlier, that the system is pretty new and therefore this is work in progress. But in due course, all the statistics will be available. Yes.
Indeed. Thank you so much, Dr. Nazila Ganatra. Of course, there was a question that if newborns can get, but you did clear that out by talking about 18 for now, because each and everything that is being done is more or less trial and error. But I'm quite sure we will be trying, not erroring. But thank you indeed so much for watching. I've been your host, Ben Troy Njue, and Len Saudingo has been our sign language interpreter, assisted by Lucy Mwaura on the bottom right of your screen. But for now,